George Zogopoulos. I'm a surgeon scientist at the McGill University Health Center, and my research program focuses on precision health for patients with and families with pancreatic cancer and bile duct cancers.
How is precision health transforming healthcare delivery, and why is it an exciting field for students to explore?
Precision health allows us to individualize the care for each patient in such a way that we could improve their surgical outcomes, for example, or their medical therapy outcomes, rather than treating patients with a one-size-fits-all approach. We individualize the care, understanding their overall health needs, as well as the specific disease process that they're undergoing. So for example, if they have a cancer, we look at their overall medical issues and then try to understand the molecular basis of their cancer and try to identify therapies that will target the molecular defects in that cancer, whereby there is hope for more precision in the therapy rather than using a one-size-fits-all approach where the therapy may not be as effective in one person versus the other.
What opportunities do students have to work on personalized medicine, including genomics and wearable technology?
In terms of genomics, there's a significant program across the department. One of the exciting programs is something called the Marathon of Hope. The Marathon of Hope is a Canada-wide initiative by the Terry Fox Research Institute, whereby the goal has been for the last 5 years to sequence 15,000 cancer genomes and germline genomes of patients. So there's a huge effort from McGill, and that has created a lot of data for students to be able to work and analyze and understand these cancers and try to identify new therapies and ways to better treat patients, including to identify which patients will benefit most from surgery and what surgeries to offer patients based on this molecular or genomic medicine discoveries. In terms of wearable technologies, I think that is a growing field, and as we develop the genomic medicine, the molecular approach to medicine, I think there's becoming more and more of a need to monitor patients on a daily basis with wearable devices to understand how they are reacting to these targeted therapies and incorporate those data into our understanding of the effectiveness of new molecular and targeted therapies.
How does precision health leverage technology and data to improve outcomes for individual patients? And how can students play a role?
So precision health incorporates large data sets. These data sets include omic data, which is all of the molecular profiling we do, anywhere from genomic analysis to RNA analysis to protein analysis, and as well, more recently, we've incorporated what's called spatial technology, where we could see the relationship of individual cells, for example, in a tumor with one another. So you have these various platforms that create data for each patient, and you could think of them as individual data sets. And then you have, the patient, the clinical data. You have their family history, for example, that will also give rise to the patient's predisposition, and if you incorporate it in there, it may help identify preventative strategies for their relatives. So you have clinical data, you have molecular data, you have treatment response data, and it all comes together somehow. And I think that is what the challenge is. And we do have a fairly strong bioinformatics core within the McGill system, particularly at the McGill Innovation Center, where we have platforms and algorithms set up already, but there's a lot of room for further discovery. And I mentioned the Marathon of Hope program earlier. that will be 15,000 cancer patients with all of this data that includes both molecular as well as clinical and clinical outcome data that students will have an opportunity to tap into and use to develop new approaches and algorithms to identify therapies and approaches to treat patients that are more effective and more individualized.
What career paths are available to students who specialize in precision health, and what impact can they expect to make?
I think it depends on what point of entry the student is coming from. If a student is coming from a clinical background, for example, the learning and understanding how to apply clinical medicine will help them in incorporating these approaches into their patient care. They would be able to bring this to their tumor boards and add a molecular tumor board component to the discussion. For students coming from a basic science point of view, I think we're in the phase where we have included and embraced the inclusion of scientists into our molecular tumor boards and our discussion of these findings and how to understand them and incorporate them into clinical care. So the impact is, I think, is the community of practice. The community of practice is growing in the sense of different specialties, and this includes basic scientists within the understanding, at least for the cancer patient that I'm more familiar with, understanding the biology of their cancer and being able to better individualize their care. So there's room for discovery for students coming in through the basic science, and there's also room for translational of their findings, and for example, at the molecular tumor board level.